Hey, you guys, welcome back for another week of topics and tips. This month I'm doing the Study With Me series. We have been really hitting it in all topics, covering everything, all of our systems, all of our practice questions, really delving into non clinical topics. And this month I'm just going to go through each little area briefly, just breaking it down and studying with you straight from my review book. I've gotten a lot of questions on my review book. Some people just needing additional, just little sessions to study. So what I'm planning to do on my, my videos I like to do during the week, my Tuesday, Wednesday, Thursday videos, I plan to just go to whatever system I'm in for that day, week. We're just gonna go with the flow. And I'm just gonna go to that area in the book, and I'm just going to pick maybe three topics and go over that and really just study it with you and walk through, because we can't cover everything all the time. We'll get to that, but I don't want to make these videos too long, but I want to make them short and sweet, but effective. So here is the review book. Hope you can see that. It is a review book for family nurse practitioners. Also, adult Gero have utilized this with success, and it is designed for the ANCC as well as the AAMP. It is broken down like how I like you guys to study, and I always tell you to study, right? So, assessment, diagnosis, evaluation, treatment. And I break it down in what I call like levels, right? So, level one, I'm telling you, read it, read, understand it. So that you're reviewing that material and understanding it, writing it out. I have interactive sections in here as well. And the interactive sections are broken down to those levels where we're doing the assessment, diagnosis, evaluation, treatment, testing your knowledge on what you've read already. And then it has the practice questions as well with rationales in it. I do a few different things of how I recommend studying in here. And I wanted to kind of do some videos to study along with you to kind of give you an idea of how I recommend utilizing this. Okay. So, like I said, I'm just going to hit a few sections from the systems that we're covering on the videos. So, like today, we'll be doing EENT. I don't want to bore you for hours on EENT, but I'm just going to turn there, hit a few things. We'll go through each little step so that you can actually progress on that particular content. If there's specific things, put it in the comments. Tell me if there's something that you're struggling with and want me to cover so that I can do these videos, because I'm just doing, I'm going through the list and things that I know that you need to prepare yourself for, and going over them with you. But if you're struggling, I don't know the areas you're struggling with, tell me and I'm happy to help. Okay. So, before I get into my videos, I always like to give the disclaimer to those of you who are familiar with me. Hey, y'all. And for those of you who are new, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I design these videos, resources, and study tips and topics to help nurse practitioners to be successful on exams, boards, as well as in practice. I always like y'all to know that, the guidelines. I know what we do in practice for our current guidelines, right? And in medicine, things are ever changing and growing, and we adapt to those things. But it also takes time for standardized tests to get to where the new guidelines have come to, right? So some of those tests haven't changed. So I'm also providing this so that you know what guidelines that you need to continue to review from. These guidelines, I'm not pulling this from what I think I know. I'm not going to tell y'all stuff that it's just, oh, Brittany thought. No, I'm not going to do that. If I'm telling you something, it's because I know it for a fact. I research it, I'm studying it, I'm going over it. I'm telling you this for a reason. I review the blueprints. It's available for you guys. I have videos on that. If you've done it in my courses, you do any of my live sessions, I talk about this all the time. Go look at the blueprint. They tell you, ANCC as well as AAMP. They're going to tell you for the breakdown of the specialty, when the test was updated, what's on it, the percentage of the things that's on there. They give you the blueprint. The guidelines that they're utilizing currently is on there. So I'm telling you what they're currently doing. So sometimes, and I say all these disclaimers and things because sometimes people come to me and they're like, "Wait, well, you should do X, Y, and Z." I know that, y'all. I do the same thing in practice, but for these videos, when I'm telling you it's to prepare you for your boards, your exams, and class, I'm telling you what you need to know for that. If I say, sometimes on my Thursdays, I'll say things I wish I knew then. And, cardiology is my primary background that I worked in for so many years. And I'll talk on that a lot. Well, I'll tell you what we currently do there. You know what I mean? So I'm always going to tell you in which direction I'm speaking from. So y'all follow it for that, those purposes. And as I always tell you guys, medicine, there's no absolutes, right? That's why on our testing and our exams, if they're giving you absolutes, that's not the answer because there's nothing absolute in medicine. There's nothing, absolute. There's no absolutes. There's no almost pregnant. So we need to have this thing down, and I'm going to tell you what it is, but you need to think how we practice, right? We do it on a patient by patient basis. So take this as such. But now that I have given you my disclaimer and my soapbox, let's get into it. All right, you guys? So let's study. So I just did a standard thing because, like I said, I'm going to do this just like if we were just sitting down, kicking it together, studying, right? You used to do study groups with your study buddies, friends, things like that, and you may be doing it still. But this is what we used to do. And fun fact about me, I was always the girl that if we were studying something, I came up with a song, a dance, a mnemonic, something, because for whatever reason, that's how my brain converts. That's where Brittany's brilliance, my little name for my mnemonics are fun things to remember things in my books and courses come from, because that's really who I am and that's how I learn to study. So we're gonna do it just like that. If something comes along in those that I need to go over in that fashion, I will. But that's why you're just going to see just this little let's study slide, because wherever I go to in that, we're just going to move how I feel like moving. Okay. So again, third edition review book, you can find it on Amazon. Um, just search my name, Brittany Weinstock, and you'll be able to see it. And if you have Prime, you can get it very quickly. And also, or you can just reach out to me and I will get it shipped out to you. But let's get into it. I'll give you the breakdown if you didn't see my other video. It is broken down by each system as I tell you guys to study. It gives you the information on the exam breakdown, AAN, ANCC, and the AAMP. Some test taking tips. This is just a table of content. So you may not be able to see that, but I'm just flipping through. And then we get into the sections for our chapter, okay? So EENT, we're starting off from the beginning. So let's just go from some things in the eyes. So let's talk. So in the beginning, I have, and I said so like a million times, but follow me. In the beginning, I start talking about the quick eye exam, fundoscopic, quick notes. You know that? Because there's a few that you should really make sure that you are familiar with. And again, I always stress to you guys, I always get the question like, oh, okay, how do I know what to study? Is so much stuff. You're getting out of school, so many things, but it's like, what should you really review? And I say everything, all systems, but really go back in and polish those areas of those common diagnoses, right? Not just because, hey, that's what they're going to test you on. That's what you're commonly going to see in practice wherever you go, right? And so that's why they test on that. So a few of the quick eye exams, I'll go through those, and that'll be one of the topics that we cover today, right? And if y'all not familiar with me, I'm a hands person, so I'm sorry. Some people say I talk really fast. I'm sorry. If I do, tell me to slow down. But quick eye exam, so cotton wool spots. You know how we have all of these things and you get on boards and it's like, I know hypertension causes that, I know diabetes causes that, and you get kind of mixed up. So that's where I like to try to break this area down. So we have cotton wool spots. This can be caused by hypertension and or diabetes, right? So hypertensive retinopathy, diabetic retinopathy, but it's most commonly caused by diabetes, right? So almost like that first line therapy, so to speak, that's that most common cause. So when in doubt for cotton wool spots, you need to think diabetes. Um, and the way I break it down when I'm telling you guys of how I structure things, but also how I want you to gear your mind, I want you to be able to quickly identify things, right? So when I say cotton wool spots, you should envision like these white patchy areas. You should think diabetes, hypertension, diabetes most common. You know what I mean? Those should be those quick things that come to your mind. So I like to kind of put those in the forefront and then kind of break it down so you can really understand it, right? So I just want you to just take that quick little blurb that I just told you, okay? So in your head, cotton wool spots, white patchy areas caused by diabetes, hypertension that is uncontrolled and not managed well, and most commonly with diabetes, right? Then we have AV nicking. AV nicking is caused by hypertension. Now, we can go a little bit deeper, and I want you to think about it. AV nicking, your arteries, your veins. What's happening is the arteries are compressing the veins and causing it to give a nicking appearance. So when you see it, it literally, you'll see an artery vein crossing, but how it crosses, you'll see where it looks like it's nicked. And bear with me, we're going to get into all of that, okay? Um, but that's due to that chronic uncontrolled hypertension and damaging those vessels. But again, we'll get a little bit deeper. But when I say AV nicking, AV, arteries, veins, but I want you to think hypertension. That's the cause of that, right? Primary cause. When I say cotton wool spots, primary cause, diabetes, hypertension. But the primary cause is diabetes. All right, now we have our copper and silver wiring, also caused by hypertension. Now you see a pattern. And so I tell my students, my review students, and previously when I was teaching, I like to say, when in doubt, go hypertension. Now I know for practice purposes, I'm not trying to just teach you the easy way, but I'm the girl that's going to tell you always, right? I'm going to give you the key identifiers and the quick way to identify it. I'm going to tell you the why and teach you the basics so that you can critically think and know. And then I'm going to tell you that, hey, when in doubt, which way to go. You know what I'm saying? I'm not gatekeeping. I tell you all avenues so that you can quickly think. And I think that in this method, I teach like that because think about having test anxiety and you're in a situation and you get flustered. When you know things like the back of your hand and you are over prepared, when you are in a anxious state, when you are in fight or flight, when that adrenaline is rushing, you're going to go to what you know, right? So that's why I teach in that fashion and tell you all kinds of things. So don't think I'm trying to give you any shortcuts. I'm teaching you in all aspects. Okay. So, again, copper and silver wiring caused by hypertension. Again, that's three things that hypertension can cause that can cause damage to the eyes. And think about it, because our blood pressure and it being elevated highly affects the vessels in our body, right? That still goes to our eyes. But the copper and silver wiring is talking about the color and the appearance that it shows up. Um, that the arteries appear during that. So they'll start to have this reddish appearance that resembles copper. That's where that comes from. And then when it's occluded, it gives like this white appearance, and that's where the silver wiring comes from. Next, we have microvascularization and microaneurysms, and this is caused by diabetes. And so this is caused by diabetes. Also, you may be more familiar with this as neovascularization. So again, short and sweet, anything the microvascularization, the microaneurysm, aka neovascularization, these are caused by diabetes. Okay, and we'll go back and more into that in a second. And then lastly, in the few eye conditions that I want to talk about is papilledema. Now, this is caused by this increased intracranial pressure. Okay, now next, now that you kind of have that foundational knowledge, and again, if you are studying along, I told you have pen, paper in the previous video so you can kind of jot these things down. Pause it, slow me down, however you may need to do this. But I want you to kind of just start making notes on those common ones, okay? So again, that's that cotton wool spots, AV nicking, copper and silver wiring, microvascularization and microaneurysms, and then your papilledema, right? So as you can see, I just kind of have it there just like that. Um, just written out with those short and sweet notes, okay? So almost like flashcard style. Bam, bam, so that you know it. When I say AB nicking, you say hypertension, right? Hypertension causes this, AB nicking. So that's how I kind of want you to subgroup those for those key identifiers. But now I want you to go a little bit deeper. Things like this, I always say, when you're studying this, go Google the images. Go Google it, because when you can see it, it's like, all right. And you don't have to be a visual learner. You're just, what do I always say? Repetition is the key to retention, right? So when you are ingraining something into your mind, your memory, your muscle memory, you are doing it from various perspectives, right? So I'm giving you the name, the condition. I'm naming it to you, right? I'm giving you the description and the causes, right? The description. Why does that sound crazy? And when you Google the images, that's another way. Now you can visualize what you're reading. And then we're going to think of the treatment and how to process all these things, right? So then next, this is what I like to do. Tell you guys to do when you're studying. Build you out a chart, you guys. Make you out a chart. Put your images in there, but see it in that fashion. Condition, the description, see the image, the treatment, have a place to write your notes. So you can build on it, because guess what that lets you do? Assessment, diagnosis, evaluation, and treatment. I always say that because that's what they test on, right? Because that's how we actually practice. Think of your SOAP notes. This is what we do, right? We go in, we're assessing the patient. They come in, signs, symptoms, and presentation. That's all our initial assessment. That's that description, how they're typically going to present, their signs, their symptoms, etc. How would you are there any diagnostic exams? What are your differential diagnoses? So that's what I mean when I say diagnosis. How do you evaluate this particular thing? How do you treat? Okay, so we were just talking about our cotton wool spots. Remembering again, what did I say? They are caused by what? Cotton wool spots. It is caused by primarily diabetes, right? Uncontrolled diabetes and hypertension, but most commonly diabetes, right? I told you to think about those white, patchy, think cotton. That's what it looks like. But this is due to the damage to the nerve fibers on on the retina. Okay, so I want to show you an image that I have on here, and I hope you can see it well. I'm trying to see which way so you can see the picture good. So you see how those little white patches are up there? You may not be able to see it, but Google it too. I usually have it, and if you look at some of my other videos, I'll add a snippet in a link in the description of some of my other videos where I actually have the pictures on there too. So if you need to really see that, I'll put that on there, okay, and the link to the review book. But they look like little white patches of cotton on the eye, and again, this is due to not, why can't I talk? Diabetic retinopathy, hypertensive retinopathy, most commonly from uncontrolled diabetes, right? Because it begins to affect those nerve fibers and it starts to swell. Those nerve fibers of the retina begin to swell, giving that white patchy appearance. And that's where the name cotton wool spots came from. Okay. Now, of course, treatment, we treat the cause, right? So the cause is uncontrolled diabetes or uncontrolled hypertension. So you want to assess those, monitor those, and then treat accordingly, right? So you're monitoring and treating and keeping them maintained to aid um, in their visual condition and issues, eye conditions. Next, we have AV nicking, again, caused by hypertension. Again, like I told you, this is due to the damage to the vessels. The arteries begin to enlarge and compress the vein, giving that nicking appearance. We treat the cause. You monitor the hypertension and you treat it to get it more controlled. Copper and silver wiring, also caused by hypertension, like I told you. I told you that these arteries have that reddish appearance and the color, that reddish appearance, so they look like copper. And then if they are occluded, they give a white appearance, and that's where that silver comes from. So if you see either of those, again, with that copper appearance or that silver looking appearance, you want to monitor that blood pressure and treat accordingly. All right. So I want to give you those images again. I want you to take a moment and just try to look at those. And also, like I told you about papilledema, this is due to increased intracranial pressure. I do not have a picture of that. But you know that has to be treated, that additional pressure. And then the microvascularization, the microaneurysm, those vessels are just what the terminology says, micro. They're tiny, 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 but you want to manage the cause, right? So managing the diabetes and treating accordingly. So let's flip. I just want to flip really briefly to the interactive section so I can show you what I mean. Also, I have a medication section here, but we don't, need specific medications for this right now. We'll talk about that when we get more into diabetes, hypertension, and things like that. But you can go check out those videos. But the medications go along with the studies. But here in the interactive section, so level one is naming the condition. So if I say, presents with a white patchy appearance on the eyes, secondary to diabetic retinopathy and or hypertensive retinopathy, what condition would you think? Cotton wool spots, right? Um, if I say fundoscopic exams shows enlarged arteries compressing the veins, nicking like appearance on the fundoscopic exam, secondary to uncontrolled hypertension, what condition would you think? AV nicking, right? Um, Fundoscopic exam shows, and I'm trying to just word it a little bit differently than how the book is to test you on what we have studied thus far, but you can see for my interactive section is broken down. It's fill in the blank because I want you to literally think and write it in there, okay, as you're studying. So fundoscopic exam shows a copper appearance in the arteries appear copper on the fundoscopic exam. What condition would you think, and what should you monitor and treat? Uh, and you should think of copper wiring, and then silver, it appears white due to the occlusion. Now that's level one of the interactive section. Now level two, we bump up next. So we're naming the condition, but now we're going to, how do you evaluate those signs, symptoms, and what diagnostic exams are utilized for this? So how do you evaluate this? So if somebody comes in or they're talking about some changes in their eyes, and or their blood pressure may be uncontrolled, or their glucose has been uncontrolled, and this is a chronic issue, you're evaluating by doing this fundoscopic exam, right? That's a part of the evaluation, and that helps to come up with a diagnosis, right? And then also further evaluating the blood pressure, the glucose, etc. And then level three, how do you treat these conditions? And in all of these, we treat the cause. We talked about that, right? So you treat the cause. You're going to treat that blood pressure. You're going to treat that blood glucose, right? And so that's how the breakdown is. And so I'm showing you this and going along with it in this fashion because this is how I want you to study. So when you're going through, think of a issue, a condition as you're going through the book, and do it system by system. Don't jump all around because you're going to overwhelm yourself. Don't study in this book, that book, this book, because things vary also, and you're going to overwhelm yourself. And now you're flustered. Now you're confused. Some things conflict because there are slight variances, right? Don't do that to yourself. Pick something that resonates with how you study, what you adapt to well. Pick that review source, your school book, and you go through it, right? And I want you to think assessment, diagnosis, evaluation, treatment, and go through that thing. So, as we talked about, cotton wool spots. The person may be an uncontrolled diabetic. You see an A1C that is through the roof. You do a fundoscopic exam. Cotton wool spots. You see that white patchy appearance. You start to think about that. Look at those Google images so because on the ANCC you may see images. AAMP, there are multiple choice. But think about it. But I want you to be able to visualize it because even in practice, when you are looking at the your patient's eyes, doing their fundoscopic exam, you want to be able to identify that thing. Look at it as you're reviewing, okay? And then your evaluation, your treatment, right? So that's how we work our way through that. Now, as we do that, let me go to some practice questions. Let's see if I can find you one quick one on one of those. I also have the practice questions by system so that you can reviewing that way. And if you want me to cover a little bit more, let me know. But I don't want to bore you with it. So I plan to, as I do the videos, just break the sections down throughout the week so it's not like overkill. I'm trying to find one on the ones we just covered. All right, let's see. So here's one, but it includes an image, okay? So the question states, upon assessment of the fundoscopic exam, how should the nurse practitioner treat? So hopefully you can see this. Okay, I hope you can see that. But there, and the answer choice says A, assess and treat the patient's blood pressure. B, assess and treat the patient's glucose. C, assess and treat the patient's cholesterol levels. Or D, assess and treat the intracranial pressure. And here, and I don't know if y'all could really see it well, I hope you could, but there are white patches on this fundoscopic exam, classic cotton wool spots. So the best answer choice would be B, to assess and treat the patient's glucose. Okay. Um, and then there's also a rationale section in here that we go through. Let me do one more thing in the eyes and then I will let you go. Well, I'm going to just stop it there so this is not overkill. I don't want to overwhelm you guys. Let's just stop for that one here today. We'll do another video on some more of this. And again, all month long, this is what I'll do. But let me know if there's a particular area that you want me to cover so that we can go a little bit deeper in this. Because I was going to talk about like the Snellen chart. Because I have a little mini Snellen chart. I don't know. Snellen chart, this is the test for visual acuity. But just, I like to really go over that because people get confused, and I have a little short video on that. So I'll just put the link to that because I don't want to give you overkill today on these things, but I'll just do the short. I'll do the short, y'all, so it's not too much on you. And tell me what y'all want me to cover more on these videos so that I can delve into what you are really struggling with. But we can work our way through this review book and just kind of start gauging your mind towards it. But as you are studying, I want you to read it. I want you to have the quick identifiers, write that out, review in that fashion, understanding the way they present the assessment, how you would see it, what you would look for, differential diagnoses and what diagnostic exams you would do, how you would evaluate that particular condition and potential differential diagnosis, and then how you would treat. And then if you saw my other series, that's where I talk about those SOAP notes. That's how you're writing it. Go ahead and prepare your mind, engage in that fashion because it's full circle on how you would approach a patient, how you would treat a patient, how you would document, how you study for these encounters, how you excel on boards with these encounter and scenarios that they're going to provide to you, and then how you provide and treat in practice. So I know it kind of sounds like a lot, but when you get into that structured flow, it will make sense. So break it down into that fashion. Okay, you guys? But as always, thank you, you guys, for watching. Please be sure to like, comment, and subscribe, and share with whomever you may find that may find this beneficial as well. If you have questions, please put it in the comments so that I can spend time to answer those and help you to better understand. And if there's something particular, as I always say, let me know, and I'll be happy to cover and do a video on it. Or if you need something personally, I'm happy to do that for you. But be sure you meet me back here, you guys. We'll go into some more areas. I didn't want to overwhelm you on this first video because I know I went through a lot of instruction, the breakdown, how we'll be studying and things like that. So we'll do a little bit more as we progress through this month, but let's get into it. All right. Bye, y'all.